Hello everybody, welcome. My name is Wilson Aguiar. I am not a dentist or a doctor, but what I will be going over today will be, and in future episodes, is something that we're going to start now at our practice that involves a lot on educating patients, you guys, in terms and things that actually happen when you are getting work done at the dentist. The whole purpose of this is so when you walk into a dentist, not only ours, but any other practice, you get to understand better on what it is that the doctor is explaining to you or what the assistants are explaining in terms of either when you first go to the practice or when, if you have a procedure that has to get done and they tell you what it is, but you might not understand. And even if you look at the definitions on a medical dictionary or just online, it might come up with more words that you just don't understand or sometimes don't even get a grasp. So today, the one thing that we're going to be talking about, or at least I am, is on PROPHYs. We're going to start something simple, and then in future episodes, I'm going to be going over different other things that doctors do. So, like you have cavities and composite fillings, root canals, and things on periodontal disease. So for today, we're going to keep it simple, and I'm going to go over PROPHYs. So, what is a prophylaxis? Short for, which is PROPHY for short. Most people know what it is. It is just what doctors and everybody refers to as a routine cleaning. Now, what is the difference between a PROPHY and you being at home and getting your teeth cleaned with your toothbrush? The difference is that one, it's being done by a medical professional, a dentist or a hygienist, and they have more understanding of what a tooth is, what it involves, what is around it, and how to preferably take care of it. And then obviously the instruments that dentists use as well as hygienists are completely different from a regular toothbrush. So it is essentially cleaning the tooth from plaque that you have accumulated throughout the months, preferably no longer than 6 months, since most of you guys know that you should be going to the dentist at least twice a year, once every 6 months. So again, a major difference is the instruments that a dentist uses as opposed to using your toothbrush. Now, there are things in the industry now, in the market, that you can get, such as a water pick, and also now they've introduced I've seen on various commercials, the actual instrument that a dentist uses, which is, it's a pick that kind of vibrates and it helps remove tartar from your teeth. It's essentially what a dentist uses in addition to their other instruments that they use to more thoroughly clean the tooth. And those are great. They're great instruments. The water pick specifically is amazing. Now, you should always use your toothbrush. You should always floss, and obviously mouthwash to make sure that you get the most out of your when you're cleaning at home. So a water pick is a great instrument. One, because it forces water down your gums, inside of your teeth, and it cleans out. And it because it's water and the pressure is not exactly that strong, it prevents a lot from having gum recession, which is one of the major issues that people have when they brush their teeth too hard. So a recommendation for that is to always buy soft bristle toothbrushes to prevent yourself from harming your gums and creating sensitivity in the gums. And you don't want gum recession because most people don't like gum recession, and it's one of the reasons why people have that. They look like as you get older, it looks like their teeth get longer. And most occasions that has to do with either they're brushing too hard or other things like periodontal disease causes gum recession. Now, going back to the water pick does not prevent it. As far as science has demonstrated and research and stuff, it does not cause that to happen, which is a great thing. And you do really get a good cleaning from a water pick. Now, the other instrument, which is again what the doctor uses to clean the teeth, and they are selling in the market, I would be more cautious with that. The reason why is because it is a metal pick and it does vibrate. If you do not know how to use it, and there's nothing that teaches you on how to use it, there might be instructions on how to do it correctly. You might want to be more careful with it, because if you can harm your gums, you can irritate your gums, and you might not clean so well because you don't know how to use it. It is a new instrument. Again, before doctors, only dentists used to have it, but now they are introducing it in the market for people to use. But again, it's not something that I would recommend using first. Maybe get used to the water pick first and then try that out. If you're comfortable with toothbrushes, then stick with the toothbrushes. Just a recommendation, always use soft bristle toothbrushes. And if you want to go into that, which again it does clean really well, but again, you might want to leave that more to a professional than try to do it at your house. That's pretty much it for today. On the next episode, I am going to be going over cavities and what a filling is and what essentially a filling does to a tooth, and what's the purpose of it. Okay, so goodbye everybody.